I'm Dr. Barbie Phelps-Sandall, an obstetrician who's been in practice for 25 years. For those who are watching this webinar, I assume it is because you are pregnant and want to learn everything you can about your pregnancy. Growing a family is a wonderful, joyous time for couples. To help your baby have the best start in life, it's important to learn about the wonders of pregnancy as well as the risks of pregnancy. Today I'm sharing with you the number one risk to pregnancy: premature birth. Premature birth is a public health crisis that many doctors don't discuss with their patients for fear of creating stress or anxiety in the parents-to-be. It can happen in any pregnancy. My goal with this webinar is to share important information about preterm birth and a new test, the PreTRM test, that is the first of its kind. PreTRM predicts risk before symptoms of preterm labor occur. In my opinion, forewarned is forearmed. Knowledge is power. I believe it's important for pregnant couples to know everything they can about their pregnancy and what is available to them to help their babies have the best outcome possible. Before I talk about premature birth, though, I'd like to share with you this family tree. All the branches are extended families, and the leaves represent members of families. But the gold leaf is a very special leaf. It represents a newborn baby. It is a symbol of new life. Every baby is precious and needs to be treated with special care, even before birth, to continue to grow and have a healthy life. This is why I want to talk with you about taking care of your baby before he or she is born. What is premature birth? Not all pregnancies make it to 40 weeks or the expected date of delivery. A full-term pregnancy is 37 to 40 weeks long. A delivery before 37 weeks is called a preterm or premature birth. In the United States, we believe we're pretty good at healthcare. We spend the most on healthcare as a percentage to GDP of any developed country. But when it comes to preterm birth, we're not so good. The preterm birth rate has risen in the United States for the past 4 years, and today, 1 in 10 babies is born prematurely. This equates to approximately 400,000 babies a year. The U.S. preterm birth rate is one of the worst in developed countries and compares to some countries in sub-Saharan Africa. According to Save the Children, the United States has the highest rate of babies who die the day they are born in the industrialized world. 130 countries have lower preterm birth rates than the United States. Preterm birth frequency. Many women are shocked to learn the frequency of preterm birth and that it can happen in any pregnancy, even when everything seems normal. It has no boundaries, no socioeconomic boundaries, no ethnicity boundaries, no age boundaries, and no health boundaries. It can happen to the healthiest 28-year-old as well as the over 35-year-old IVF mom, or a mom who lives in a suburb or inner city. Every 15 minutes, 420 babies will be born prematurely, and 30 babies will die from prematurity. Annually, worldwide, 15 million babies are born prematurely, and over 1 million of those babies will die. Pregnancy risks by the numbers. Compared to preterm birth, other pregnancy risks occur much less frequently, but are tested for as part of common genetic testing panels. Preterm birth occurs more frequently than most genetic diseases combined. For example, most women are now screened for trisomy 21, which is the gene associated with Down syndrome. And Downs occurs in 1 in 700 pregnancies compared to preterm birth, which occurs in 1 in 10 of pregnancies, or 70 times more often. Another example is umbilical cord blood banking, which parents might use as an insurance policy for their child's future illness or diseases. Cord blood banking is offered to most women during their pregnancies and is a widely known option written about in pregnancy websites and books. The actual use of one's own stem cells from the banked cord blood is 1 in 5,000. Even preeclampsia, the pregnancy risk that many women have heard about, occurs 1/3 of the time that preterm birth occurs. Preterm birth risks. There are some common risk factors that put women at higher risk of preterm birth. Some of these your doctor will ask you about as part of your medical history evaluation. If you've had a previous preterm birth or an ultrasound shows that you have a short cervix, you are at increased risk. If you've had previous miscarriages or there is less than 18 months between this and your last pregnancy, you're at increased risk. A family history of prematurity by a relative on your maternal side, such as grandmother, mother, or sister, or if you're over 35, puts you at greater risk. If you're an American of African descent, your preterm birth rate is twice the level of a Caucasian woman. If you have medical conditions such as diabetes or high blood pressure, you could be at increased risk. If you conceive through IVF, are a smoker, or have had cervical surgery such as a LEEP or cone biopsy, you could be at increased risk. Other risk factors recently published include high levels of air pollution, vitamin D deficiency, and sleep disorders such as sleep apnea or insomnia. These risk factors are considered group risk factors, meaning that women who had these risk factors had a higher rate of preterm birth. But they are not your individual risk factors. If you have a group risk factor, it doesn't necessarily mean you'll deliver your baby prematurely. Why is the premature birth rate so high? Because it is usually unexpected. First, 40% of preemies are born to first-time moms. Why does that impact the preterm birth rate? Because the single most reliable predictor of a preterm birth is a woman who's had a previous preterm birth. So, for first-time moms, you don't have that predictor. Another factor is that up to 50% of women who have preterm babies have no known risk factors. And the third factor is more than 80% of women who have a premature baby can't be identified by the two key traditional methods of previous preterm birth and short cervix. Most parents who had premature babies were not aware of preterm birth statistics. In a recent study sponsored by Miracle Babies and Sarah Prognostics, 69% of parents who had premature babies didn't know 1 in 10 babies is born premature. 76% didn't know the severity of premature birth, as it is the leading cause of infant death and illness. 79% didn't know that women without risk factors account for up to 50% of premature birth. And 78% didn't know that premature labor can't be identified in the vast majority before symptoms occur. What happens if my baby comes too early? Critical fetal development occurs throughout pregnancy, so it's important to carry your baby to full term if possible. Here are a few examples of fetal development that take place later in pregnancy. Brain development. Even at 35 weeks, a baby's brain still needs to grow 50%. Feeding difficulty. Prior to 34 weeks, babies are unable to suck and swallow normally. Lung development. Lungs are not fully developed until full term. Body temperature regulation. Babies cannot regulate their body temperatures until week 37. Short-term impact on babies' health. In the short term, premature babies have numerous medical issues that require more hospital and neonatal intensive care unit time and pediatric visits. These problems may include anemia, severe breathing problems, bleeding in the brain, jaundice, low blood count, and infections. Long-term impact on babies' health. In the long term, over the life of a child, premature birth can affect development, education, and the ability to work. This may include chronic lung disease, intellectual disabilities, brain function disorders, hearing and visual impairments, behavioral problems, and a shorter lifespan. Mom's health. We rarely discuss the impact premature birth has on moms, but studies have shown they have a higher risk of health problems such as coronary heart disease, ovarian cancer, and postpartum depression, to name a few. In addition to health issues, divorce rates are also higher due to the additional stress and challenges associated with having a preterm baby. Financial impact of premature birth. In 2007, the Institute of Medicine estimated the cost of premature birth to be $31.5 billion, adjusted for inflation. The average daily NICU cost is $3,000. The average cost of a premature baby is 10 times that of a full-term baby in the first year of life. That equates to approximately $54,000 on average for additional care, medicine, and medical visits. And in the first year of life, a premature baby has 40% more doctor's visits than a full-term baby. A premature baby averages about 20 visits a year, compared to 14 for a term baby. 3 reasons to know your individual risk of preterm birth. 1. To give you and your doctor information to better manage your pregnancy. If your doctor knows you have increased risk, they have tools in their tool chest to help manage your risk. 2. To help you plan and prepare. Just like the doctor has tools, there are things you can do as well. And 3. To help give your baby the best start in life. There's no bigger gift you can give your baby or your family. The PreTRM test. PreTRM is a first-of-its-kind test that predicts your individual risk for premature birth, giving you and your doctor information that was never before available. This information can help to better manage your pregnancy. There are 6 things I want you to know about the PreTRM test. It is a simple blood test prescribed by your obstetrician or healthcare provider, performed at 19 to 20 weeks of pregnancy. It works by measuring and analyzing proteins in your blood that are linked to and highly predictive of premature birth. It has been clinically validated in a large study of 5,501 women at 11 obstetric centers across the United States. Clinical validation means it was tested in a rigorous study and was found to be highly predictive of preterm birth. The validation study was published in a top-tier peer-reviewed journal called the American Journal of Obstetrics and Gynecology as an editor's choice article in 2016. The test was shown to be highly predictive of premature birth in all women with singleton pregnancies, regardless of age, race, or ethnicity. If you're at increased risk, knowing that your baby may come early gives you the power to prepare, get extra care for your pregnancy, and help give your baby the best start in life. Moms who had premature babies told us that if they had a chance to know they were at risk for having a premature birth, they would have wanted to have known. These 3 moms shared what it would have meant to them to know early they were at increased risk of delivering their baby prematurely. Amy Rincon shared, "We are those typical parents who had no idea that prematurity was such a prevalent thing until it happened to us. If we had known, we'd have had the opportunity to prepare and do everything possible to give Miranda the best start in life." Angela David said, "When I had cramps at 29 weeks, my doctor examined me and sent me home, not appearing concerned nor offering any steps to help me prolong my pregnancy. I went into preterm labor at 33 weeks, followed by several hospital visits before I delivered my daughter at 39 weeks. We were very lucky. If I would have known I was at high risk for having her early, I would have made sure my doctor and I were more proactive earlier in my pregnancy to give my daughter the best outcome possible." And from Gina Schroeder, "My first baby was born 9 weeks early. If I would have known in advance that premature birth can happen to anyone, even someone like me who was young, healthy, with no outward signs of being at increased risk, I would have taken the time to learn everything I could about preterm birth. So then I could have done everything in my power to help my baby." In all three cases, these women wanted to be empowered with information that could help their baby. Women ask, what if I'm found to be at increased risk? If your preterm test shows you're at increased risk, you and your doctor will put together a plan to manage your risk. It may include one or a combination of the following: high-intensity care management, where the doctor may increase your appointments, or you'll receive calls from the staff to check in with how you're doing, with the goal to uncover early symptoms of premature labor. Progesterone, either vaginal or intramuscular injections, could be prescribed according to guidelines or protocols established in their practice. Serial cervical length measurements, performed in frequent intervals, could also be done. A short cervix is a sign of a possible premature delivery. Again, they'll want to learn this early in your pregnancy, so an intervention can be prescribed sooner rather than later. Your OB could also refer you to a maternal fetal medicine doctor who specializes in high-risk pregnancies. The OB and MFM will then co-manage your pregnancy to assure you receive the best care possible. Other considerations to manage your risk could be a pessary, which is a device that is inserted into the vagina to support the uterus. Tocolytics, also called anti-contraction medications or labor suppressants, used to suppress premature labor. Steroids and cerclage, which refers to a variety of procedures that use sutures or synthetic tape to reinforce the cervix during pregnancy. All of these tools, methods, and procedures have been published in peer-reviewed journals as interventions that may help prolong pregnancies in high-risk women. What could you do if you're found through the preterm test to be at increased risk for delivering your baby early? In a recent survey, parents of premature babies, both moms and dads, were asked, what would they have done if they knew they were at risk for delivering their babies early? Here are the top responses. They would emotionally prepare their family, prepare their employer, investigate NICUs, and meet with a neonatologist. Research premature birth, either by talking to their doctor or researching online, as well as research ways they may be able to help prolong pregnancy. They would also make sure they knew signs and symptoms of premature labor and contact their doctor immediately if anything seems wrong. They also mentioned modifying third trimester travel plans, both mom and dad, plan their nursery, as well as having the car seat ready in case of an early delivery. Signs and symptoms of premature labor. One thing important for all pregnant women to know is signs and symptoms of premature labor. If you have even one of these, call your healthcare provider immediately. Contractions. The abdomen tightens like a fist every 10 minutes or more often. Change in vaginal discharge, leaking fluid or bleeding from the vagina. Pelvic pressure, the feeling that the baby is pushing down. Low, dull backache. Cramps that feel like a menstrual period. Abdominal cramps with or without diarrhea. Also, if you feel that something just isn't right, trust your intuition and call your doctor. In a Miracle Babies, Sarah Prognostic sponsored survey with moms and dads who had a premature baby, looking back, these families shared they wish they'd known their risks and what to look for. Over half had no discussion with their doctor about premature birth prior to labor. Over 2/3 did not even know they were at risk until they went into premature labor. 95% would have wanted to know, and of those, 98% said they would have wanted to know even if the outcome couldn't be changed. The preterm test is not currently covered by insurance. Health savings accounts, HSAs, and flexible spending accounts, FSAs, can be used to pay for the test. Sarah Prognostics also offers payment plans. Growing your family is an exciting time in life, and everyone hopes for a healthy, happy baby. Remember, knowledge is power. The more we know about your pregnancy, the better chance we have of making sure you have the best outcome possible, giving your baby the best start in life. I wish you nothing but good luck in growing a family tree with the healthiest babies possible. The preterm test is an investment in your pregnancy and in your baby's life. If you'd like more information about the test, you can visit PreTRM.com or call PreTRM support at 801-990-6607. Thank you for watching.